After profiting from an opioid epidemic they helped to create, Purdue now has the solution, a cure for it. Stay tuned. Welcome back to Live with Dr. McGee and Brian. Today on our show, we're going to be exploring a bunch of different topics. First, I need my old man glasses on. Purdue. So Purdue is a pharmaceutical, corporation, huge international corporation, and they were the makers of the one, the only OXYCONTIN. So now Purdue is pursuing an overdose antidote after it made one of the most devastating drugs in the history of opiates in a long time, which just seems almost hypocritical. I don't know. Have you read this at all or anything on this or seen this lately?
Yeah, what was the drug that they're working on?
The new drug is called... they're going to fast track it. It's named NALMEFENE.
Right, nalmefene.
Nalmefene hydrochloride. It's an injectable emergency treatment intended to rescue people suspected of having opioid overdose. So what's the difference between that and...
Yeah, so nalmefene is actually, you can also take it as a pill, and it's used in Europe to treat alcohol use disorder. And it's just like naloxone, it's an opiate blocker.
Okay.
So it completely blocks the opiate receptors. So if you've had an overdose, just like naloxone or Narcan, nalmefene can basically block the receptors so that they can take you out of a coma, for example, if you're not breathing or you're unresponsive. And it's a little bit longer acting than naloxone. And so if you have somebody who's had a very serious overdose, and you're worried about if they're using Narcan and the Narcan's worn off, then you can use nalmefene and that will last a little bit longer than the Narcan does.
Huh.
Yeah.
It just almost seems like hypocritical. They make a drug that they know the damages, and I know they're being sued. There's about 2,000 lawsuits against them right now.
Right.
But there was another story that I saw here that was interesting. It's another FDA fast track, which I don't know exactly how that, well, I know how it works, but it kind of blows me away. So I had read an article on where if you are a pharmaceutical corporation and you want to get something to market, you can pay an additional fee to fast track it through the system.
Mm-hmm.
And you still have to do your clinical trials, which are kind of subjective, it seems like.
Mm-hmm.
But you can get to market faster.
Mm-hmm.
So this company, let's see, a nasal spray called esketamine.
Yes.
Which they're using for depression.
Yes.
So it's a nasal spray, esketamine, and it's derived from ketamine, which everybody on the world of drugs and alcohol knows Special K and ketamine and the abuse of it. But how do they not... I mean, I see some of the stuff that they talk about helping depression and so forth, but at the same time, how are people not going to abuse the shit out of this drug?
Right.
You know?
Well, there's going to be... They have a special procedure for it called REMS, REMS, which I don't remember what that stands for, but what it basically means is a special protocol for tightly controlling the medication. Esketamine is actually, if you think about molecules as being left-handed or right-handed, you can have the same molecule as sort of a left-hand version or a right-hand version. And the left-hand version is generally called the S version, and the right-hand version is generally called the D version. And so esketamine is actually just ketamine where the right-handed molecule has been taken away, and the more active molecule, the S molecule, is left. And normally it's given intravenously, but you can also give it intranasally. And it is a very effective treatment for treatment-resistant depression. In fact, even now, people are getting ketamine in special ketamine infusion clinics for treatment-resistant depression.
In the U.S.? Or?
In the U.S.
Really?
Yeah,
But do they ever test these things, I
There,
guess, for addiction side of
there
it as
is.
far as abuse?
So with the esketamine, it can only be, they're really putting tight controls on it. It can only be administered in the physician's office. So you can't take it home and you can't abuse it. And you have to be monitored for 2 hours after you've been given your dosage. So they're using esketamine in a tightly controlled way to try and minimize the risks of abuse.
But it could be abused.
Not with that kind of controls because it's being administered and monitored and managed by a physician. In other words, they're not taking it home with them.
Okay, so but like on this nasal spray stuff, they wouldn't be taking this home, or
No, no,
really?
no. It would be held and managed and administered by the physician.
Okay, because the way it makes it sound, they're talking about a nasal. What is this? What does it say here? Da, 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 da. A nasal spray,
Right.
but it doesn't talk anywhere in this article about people not taking it home.
No, yeah,
So,
they won't be allowed to take it home.
okay, huh? That's
Now, I've
interesting.
actually prescribed regular ketamine compounded that I have let patients take home. And although there is a low risk of abuse, I and I've heard reports of it, and there is that risk. It's just the same as the risk for abuse of opioids and the risk for abuse of amphetamines. I mean, there are a lot of controlled substances. Ambien is a risk of abuse. Sleeping pills, Ativan, Xanax. There's many drugs that are prescribed thousands and thousands of times every day by thousands of providers over the whole United States that have a risk for abuse. And ketamine is just another agent that does have some degree of risk of abuse, just like many other agents that we prescribe.
I mean, if it works, it works. But I
Yeah,
know that, like originally, what was it? Heroin was supposed to be a cure for the morphine addiction, and we've seen all these different things that they've come out with over the
yeah,
years
yeah,
that are supposed to be this new solution for something else. And it seems like
yeah,
uh, people have a way of finding ways to abuse it
yeah.
if they have that mindset.
There is that risk. In fact, I even saw an editorial in one of my newsletters about ketamine being the new OxyContin. That but I do
Awesome.
there is that risk of abuse, but you kind of have to balance the benefits versus the risks.
Yeah.
Ketamine's been around and has been used now for treatment resistant depression for about 10 years or so, and there are really literally hundreds of studies showing that when nothing else works, oftentimes ketamine will work. It's an amazing drug. And what's incredible about it is, normally antidepressants take about 2 to 4 weeks to work, right? Ketamine can work almost instantly. Like people will feel better literally the same day that they get their infusion of it. It's miraculous the way that it works.
Would it be, if somebody has a history of abuse, though, could it be a triggering event? Or, I mean, you know what I mean? It's like,
Yeah,
because depression and recovery and abuse and all those, they're all like
yeah,
stepsisters.
yeah,
But, how do you determine when it's safe for somebody, given a history of abuse with,
yeah,
narcotics or whatever you want,
right.
drugs, um, the risk versus the benefit
Yeah.
ratio?
If somebody has a history of addiction, then giving the S-ketamine, for example, in a controlled environment where it's being managed by a physician and the patient isn't managing it
Hmm.
is a good control.
A little safer.
Yeah.
All right,
Yeah.
cool. Well, that doesn't mean go run out there and get a bunch of ketamine and decide to start inhaling or whatever. It means talk to your doctor, please, first, before you make any decisions. Especially people in recovery, this could be something that you really definitely want to talk to your doctor and make sure that they're on board with where you're at. So take that into advice, please.
Look, Mom, no hands!